So the next case that I'm going to share with you is that of a 23-year-old woman who had neurotrophic keratopathy, and she came to her clinic mainly with the goal of healing persistent epithelial defects that were recalcitrant to other therapies. She had failed lateral torsorrhaphies and other soft lenses and other modalities, including serum tears, and those defects had not healed. So fortunately, with the use of our devices, we proceeded to fit this patient. This was back in 2006. Again, back in 2006, even less. There was anything, no notion of potential impact with clearance, right? But we always had this philosophy, this style in the fitting approach. So that has stayed the same throughout. So much so that in the medical record, the way we would qualify the clearance, it was either generous, adequate, or shallow. We would not even put a number to it. This is back in 2006. And so believe me that when we label these faults as generous, we're talking way beyond 500 microns, right? And so fortunately, we were able to resolve these epithelial defects in 12 days, but as you can imagine, we had significant sequelae of opacification from this defect and neovascularization. These are her eyes. And so you can see the dense opacity in both eyes, but you can see, and then you can see some feeder vessels where the PEDs used to be. But again, the left eye is way more compromised. You can see that there's much more extent of the feeder vessels, but you cannot see any pupil structure behind. So we fitted this patient. The goal was to heal the defects, and then the patient was going to continue to wear these lenses to support the ocular surface and hopefully prevent further epithelial breakdown. The patient was from out of state. This is not something new to us. We handle a lot of patients from out of state, and so we co-manage with the referring doctor. So we sent a letter to the doctor, and the instructions were that, the patient was to follow with the corneal specialist and return to our clinic in 6 months. Well, as it may happen to a lot of you, this patient actually, unfortunately, did not return to clinic. And so what we tried to do was to reach out to the corneal specialist over time just to see how the patient was doing. And we were just obtaining medical records until we were able to see the patient. So in 2007, we obtained the medical records. The report is that the patient was doing well. There was no more PEDs, which is great, stable ocular surface. But the corneal specialist relays to us that there was still dense opacification. The vision was at 2400 in both eyes. In 2008, the patient doesn't return again, but now we start to see a little bit of change because now we have a report that this ocular surface is stable, but the vision is actually improving, especially in the left eye, well, both, but the left eye a little bit more, from 2400 to 2100, 2080. So that was encouraging to us, even though we were not seeing what was happening, but the report was that there was still some opacification. Finally, I'm not going to belabor the point, that the pattern continued and we continued to stay in touch with the corneal specialist. The patient doesn't return to our clinic until 2012, fast forward time, mainly because she was having problems with the fit, comfort in the right eye. So it seemed when we evaluated that lens over time became a little tight. It was a little suction. When we tried to remove the lens, it was hard to remove. And you can see that from the hyperemia in this region after we remove the lens. 2100 in the right eye, but by then the left eye that was well fitted and had no complications, the patient was super comfortable. The vision was already at 2050, and look at the presentation in that cornea already. And this is again with generous faults, clearances of over 500 microns and beyond. There's already significant clearance without any complications of edema, potentially from this hypoxia. And so why is it that we hypothesize that the reason we saw this significant clearance in the left eye and not so much in the right eye, it was perhaps because of the way we the endpoint of fitting in this eye. It was looser, and we think there was less suction over time. Perhaps there was more tear exchange, and oxygenated tears could flow underneath. In comparison to this eye that over time got tighter, this is the reason the patient eventually returned, and this eye didn't benefit from the benefit that the left eye had. So the patient, in conjunction with a corneal specialist, decided that they wanted to have a corneal transplant, which they did. And so back in 2015, and I should say that on this occasion, because the patient was doing so well, we didn't change the fit in 2012. All we did was order a replacement device, just a replica, just so that the patient could have a new backup, because this lens was particularly old. So fast forward time, 3 more years, the patient returns so that we could refit the eye that had been transplanted. We kept the same fit in the left eye, and see, it still had generous vaults, but look at the progression in that left eye. From 2006, how we started, to see significant clearing in 2012, 6 years, and a total of 9 years with the same lens, same type of fit, but just distributing the weight, no tightness, etc. Even with this generous faults, look at the significant clearing, right? So what gives, right? There's got to be something more. And that's what we would hopefully learn from today, is that we need to look at the whole system in order to hopefully obtain this good physiology.